in the nasal cavity, they will be beating backward and downward towards the pharynx, towards the oropharynx. Okay? Same would be happening with the paranasal sinuses. The cilia will be, pushing the mucus, which is the film of mucus which is lying on top of the cilia, towards the oropharynx. But in case of the larynx, there would be an upward beating of the cilia, upward and backward, because upward and backward will lead to, again, the mucus will be ultimately be landing into the pharynx, the hypopharynx, which is, or the pharynx proper, which is lying behind the larynx. Okay, so there would be an upward and backward movement of cilia that will be pushing the mucus towards the pharynx to be swallowed. Okay, swallowed down. Alright, what I was telling you was the mucosa lining the entire laryngeal apparatus from inside. It has a lot of mucus secreting glands, seromucous glands, and especially you can see over here the inferior surface or the laryngeal surface of the epiglottis. It's been covered by the mucosa, which is having huge seromucous glands, because we need a lot of lubrication in this region due to the excessive use of this area. Okay, so there is a constant movement going on, so there would be slimy mucus which will be required to provide a friction-free movement all the time. Okay, and there is another very important feature, that the mucosa, except for the region which is directly lying on top or it's covering the vocal ligaments, the mucosa of the vocal folds, it does not have much of the glands. It's tight, adherent, and doesn't show any movement. But what will happen with the vocal cords or the vocal ligaments are constantly in a state of vibration, and there is a lot of movement going on, so there would be chances of friction. So I told you that just above the vocal folds we have the vestibular folds. So the vestibular fold, the space between the vestibular fold and the vocal folds is the laryngeal sinus. The mucosa, which is covering the laryngeal sinus just above the vocal ligaments, would be having enough amount or number of mucus secreting cells or mucus glands that will be constantly producing mucus to lubricate the constantly vibrating vocal cords or vocal folds. Okay? Now the bad point, or what is the negative point about having such a loose mucosa lining the laryngeal cavity? There are much more chances of inflammation in case of any infection, because there is enough space available, so there would be more chances of swelling. Except for the mucosa which is covering the vocal folds, that doesn't have much space in between. It's tightly adherent to the vocal ligaments, which are elastic in nature, and they do not allow accumulation of any inflammatory fluid. So thank God we cannot suffer from the swellings, direct swellings in the vocal folds. Otherwise it would be a fatal condition. But because the glottis will be closed, so the airway is blocked. But there are certain conditions, like remember I told you, when I was discussing the oropharynx and laryngopharynx, I did mention a disease, an illness which is being caused by Corynebacterium diphtheriae. That is, the condition is known as diphtheria. That the diphtherial bacteria will be producing a lot of toxins, and that can involve the laryngeal laryngopharynx, and that can also, the membrane, the epithelial membrane can extend up to the level of the supraglottic region of the larynx. So that can cause an instant blockade of the glottis or the airway. Okay. Other than that, that's a very, very critical condition. But other than that, a common condition that's known as laryngitis, that can be caused, and there would be a lot of inflammation, a lot of swelling in the region of vestibular folds. So there would be, change in the caliber of the voice, because there would be swelling and limited movement. The vocal folds, yes, they are not, they are not swollen, but the top part is all swollen. So there would be definitely a change in the voice if a person is suffering from laryngitis. Then there is a condition which is known as croup. Laryngotracheobronchitis. That's an extended, like a descending type of infection that starts from the larynx, and then it can involve the trachea, and it can also reach up to the level of bronchial tree. That's normally the victims are usually the kids from 3 to 6 years of age. They suffer from croup a lot, and there is a typical, barking type of cough that is a hallmarking feature of croup, a diagnostic feature of croup. We call it, and there would be stridor, like a sort of abnormal sound that would be coming during respiration. Okay, especially the phase of inspiration. Yeah. Then there is a condition that is pretty much fatal, and if it occurs especially in adults, because there is a vaccine that can prevent the disease to occur in children, but the adults cannot get the vaccination for Haemophilus influenza B type. Okay, that can cause a condition known as epiglottitis. Okay, the epiglottitis is, again, it's a very aggressively growing condition, and there would be severe inflammation of the epiglottis, and it will initially, the symptoms will resemble any kind of upper airway infection with fever, chills, and change in the voice, like hoarseness of voice. But if it's in children, a child will definitely be suffering from lack of sleep because of too much obstruction, because the entire epiglottis, the mucosal lining of the epiglottis is all inflamed, and there is obstruction in the airway. So he won't be able to sleep properly, and there would be a lot of drooling, because I told you that there are the lateral glossoepiglottic folds are there, and they hold the saliva on either side. There are wells of saliva. So if there is too much inflammation, that withheld saliva will be constantly be drooling out, and if it stays unattended, this condition ultimately can lead to death, because if you will not start the patient on antibiotic, there would be complete obstruction of the airway, complete obstruction of the glottis, and the person can die. And usually the adult patients, they usually suffer from this. If they suffer from epiglottitis, its likelihood is to ultimately leading to death. Yeah. So these are the few things which are really very important. Other than that, the mucosal lining of the respiratory tract, it's having a lot of a huge collection of white blood cells, just like a mucosal lining anywhere else in the body which is exposed to the external environment. The respiratory tract and the gastrointestinal tract are the most exposed tubes of our body. So the mucosa and the submucosa would be having huge collections of WBCs of all types. And yeah, that's it. Alright, as we are done with the normal anatomy and the anatomy of the larynx and pharynx, as well as their innervation, the musculature, everything, before closing this topic, it is really important to know about, first of all, about the mucosal lining of the larynx, as well as there are few spaces related to larynx which hold clinical significance. One of those spaces is known as the piriform recess or the piriform fossa. So we have a couple of them, so one on each side, so we call them piriform fossae or piriform spaces or recess. Okay, so piriform. The name is indicating that its shape must be like a pyramid, or it's roughly triangular in shape. So let me explain it to you where each of the piriform recesses is located. So I'm holding the model of the larynx in front of you, and you are viewing the model from behind. That means you have removed the wall of the pharynx. So the wall of the pharynx, because we know that the pharynx is a fibromuscular tube, so what we have done, we have sectioned, we have given a midline section at the median raphe of the pharynx, and we have cut it open to provide you with an inside view. Okay? Here on top, inside the oral cavity, we have the tongue. The posterior one-third of the tongue, just behind the posterior one-third of the tongue is this structure line, which is the first unpaired cartilage of larynx. That's the epiglottis. Okay? So keep in mind that we are viewing the larynx from behind. Alright, so here, first I will talk about the boundaries of the piriform recess or the piriform fossa. So medially, it is bounded by this green colored band, which is airy epiglottic fold. And you remember we have two of them, one on either side. Airy epiglottic folds. Okay? That's the medial boundary of the fossa or recess. The lateral boundary of the piriform recess would be the inside or the medial surface of the lamina of thyroid cartilage. So the mucosa lining the medial surface or the inner surface of the lamina of thyroid cartilage will be making the lateral boundary of this fossa. Then, by the way, let me explain, the fossa is like an inverted pyramid. It's an inverted triangle with its base facing the back of the oral cavity, as you can see, and its apex pointing down towards the esophagus, the lateral walls of esophagus. Okay? So here I told you that the tongue, the posterior one-third of tongue is located. So we have, when we talk about the superior margin or the superior limit of the piriform recess, I will say that the lateral glossoepiglottic fold. Okay? So here you can see this is the median glossoepiglottic fold, and these are the two lateral glossoepiglottic folds. So the superior boundary or the superior limit of the piriform recess would be marked by the lateral glossoepiglottic fold on either side. Okay? The medial boundary is being marked by the airy epiglottic fold of that side. And the lateral boundary has been marked by the mucosa covering the inner surface of the lamina of the thyroid cartilage. Now you can imagine, if you look at this model up here, so we can easily figure it out that it's a very deep fossa. It's a very deep recess present on either side of the larynx. Okay? And now you imagine that this space is located between the pharynx and larynx, because if you consider my hand as the pharynx It's muscular too. So the piriform recess is located between the larynx and the pharynx. And you know, if you consider my wrist as the esophagus and here is the trachea, so you can see that the piriform, the apex point is of the piriform recess is pointing towards the lateral walls of esophagus on either side. And I would say it will continue. The fossa continues down as a pointy apex. All right? Now, what's the clinical significance? It's a deep recess, sort of a blind pouch. Okay? And it's the most common site for the foreign body enlargement, most of the times. And what's good about this fossa is that here, if you remember the thyrohyoid membrane, and there was an opening for the internal laryngeal or the superior laryngeal nerve. So the internal laryngeal nerve was lying on the base, it lies on the base of the fossa, okay? So it's easy to apply a topical anesthetic and anesthetize the nerve to perform any procedure in the region of piriform recess. Most of the times the procedure involves the removal of the foreign body. Sometimes there is another significance of this fossa because it's a very deep space on either side. Any malignancy that is growing in this region can stay quiet for a very long time. It can remain undetected. So it's better to examine the piriform recess every now and then if the patient or the person is complaining about, you know, problems with swallowing, dysphagia or dinophagia, difficult and painful swallowing. So it's better to examine the piriform recess on a regular basis. And what would you do? You will ask the patient to hold the breath within the cheeks, within the mouth, and, you know, blow up the mouth and just hold the breath. So you will be able to, at that time, through that endoscope, you would be able to view the fossa. Okay, so it's really very important to know about the anatomy of the piriform recess because it's always a very confusing point where these recesses are lying and what's the significance of this recess. Other than that, we have something which is pretty much towards the oral cavity, at the back of the oral cavity. We have these, you know, you call them valleculae. Okay, these are the shallow depressions present on either side of the back of my oral cavity, where the epiglottis is joined with the help of mucosal folds. It's been connected to the posterior 1/3 of the tongue. So that region, that depression, is known as vallecula or valleculae. Vallecula. Okay. So this is also a site for you know, any growth, or sometimes a foreign body can get lodged over there. But mostly it is considered to be the wells of a spit. So it holds, like on either side, the valleculae hold the spit for some time for the saliva.